Good morning, Dana.
Good morning, Dr. Rahman.
Please share your story.
Well, back in 1998, our daughter was born. I had an epidural, and things developed in my body that totally developed into my knees first.
How do you mean what happened with the knee?
Severe pain,
Mhm.
and it attacked both knees, and the body itself was having lots of pain.
So all over, not just one place.
All over.
Mhm.
But I'll never forget the time sitting at the dining room table. I tried to get up out of the dining room table, and I could not get out of the dining room chair, away from the table.
And how old are you at the point? In your 30s?
Yes,
Okay.
yes.
Okay. And so I remember you're saying, I'm only in my 30s, like, this shouldn't be happening to me.
Right,
Yeah.
especially when my husband turned 40. It was soon after he turned 40, his birthday, that I had this happen. So I didn't understand what was going on. And from there, we went on to many doctors, and my health pretty much was starting to decline rather quickly.
Mhm.
And they checked I've gone to many doctors, endocrinologists, neurologists, MDs, specialists. The list goes on for many, many years.
Mhm.
Even went to the Mayo Clinic.
This is in Rochester?
Yes, sir.
Okay.
Yeah, and went to the Mayo Clinic. Actually, I've gone to Mayo Clinic twice. They prescribed, first time they prescribed a medicine, an old-time drug,
What was her diagnosis?
fibromyalgia.
Okay. And this was diagnosed by the specialist there in fibromyalgia?
Yes, an
Okay.
endocrinologist.
Okay.
Yes, and put me on a medication that literally was not helping me whatsoever.
Was it a rheumatologist or endocrinologist?
It was an endocrinologist, but also the doctor in Kansas City was a rheumatologist and thought I had rheumatoid arthritis first.
I see.
And then Mayo said it is fibromyalgia.
Okay.
They did all the testing and all the x-rays and all the
They put you through the works?
Yes.
Okay.
Yes. And said I had fibromyalgia.
So that was their final diagnosis after doing all the tests that they know?
Yes.
Okay.
Yes, it was. They put me on an all-time, it's supposed to be, it's nortriptyline was the drug, and it's an old-fashioned drug, and it was supposed to get me down in my REM sleep and try to help the body. Long story short, it almost killed me. It was actually not the right drug for me, and
Okay.
another Mayo Clinic specialist found this problem and said you should not have been on this medication.
So they changed medications. Did that help you a lot?
No.
Okay.
No.
So what were you given to understand at that point about fibromyalgia?
Fibromyalgia was something that I had to live with for the rest of my life, and there was nothing else to do but monitor it with drugs.
Mhm.
And I had gotten even worse after the first Mayo visit and seen this other specialist. And I couldn't even eat right. They did radioactive egg tests, and food would just settle in my stomach. It was really affecting me horribly.
Okay.
I had a tremor in my hand. They almost thought I had some Parkinson's. Well, Mayo...
What'll happen with your hand?
They didn't understand.
No, what'll happen with your hand? With it?
Oh, I would just shake 24/7. I mean, I would try to eat, food would fall off my fork. It was very embarrassing. Headaches, 24/7, never did go without a day without headaches. Body pain, horrible.
You also, I believe, you said a buzz.
Oh yes, my ear, when I had my headaches, which was 24/7, I would hear like a grinding fan. It was just nothing was clear. It was just always a noise grinding in my head, in my ears.
Okay.
And then I'd get ringing in my ears, and then I would get on the right side, I would go numb. Things would just rather progress.
When you say right side, leg and arm?
Well, yeah, arm, and one time it did like half my body. One time at 4 in the morning, I'll never forget it, that I could draw you a line all the way down through my body from head to toe.
So you probably worried there was a stroke or something?
Yes, I did, very much so. And there you go back in, and you get you go in for an MRI and CAT scan, nothing was showing.
Okay.
And then I went back up to the Mayo Clinic as I was saying to the specialist, and they had a new seminar. It was actually a fibromyalgia 2-day clinic.
Mhm.
And there you got to see other doctors. And besides doctors, you got to see other patients that were having the same problem. And they would gather you around a table and you talk about your issues.
More like a support?
Support in a way, yeah. It was something new that they had just tried. They were trying out.
And I think I remember you're saying they were kind of telling you how to manage it, like not lean over to
Yes.
use a dishwasher or something?
Yes, how to unload a dishwasher, how to do laundry, and I'm going, I'm too young for this. This cannot be happening to me,
Mhm.
because the way you bend down, the way you turn your body, like
Backstory, you've always been an athlete.
very much so.
And so that's even, you've never been somebody that sat around in the first place.
No, absolutely not. With my husband and our 3 children, a business, and come from athletics,
Yeah, Bob used to be a football coach?
baseball coach.
Baseball coach, okay.
Yes. And sitting around was not in our vocabulary or in our livelihood. So, and I kept going. I
Mhm.
mean, there was a few days that it kept me in bed, that I could not get out from the early stages on.
Mhm.
But then had an implant put in that wasn't really right.
It's a dental implant, and you
Dental.
had some questions about it. You happened to come, you had given up by then finding a solution for this.
Yes, I was living with fibromyalgia on a drug. They changed my drugs.
And you planned on living with the rest of your life.
Yes.
Okay.
They said there was no cure. This is just how life was going to be.
Mhm. I mean, the best clinic in the world, so to speak.
Yes,
They say
Mayo.
that. Mhm.
Mayo knows it all. I mean, Mayo is the prestige clinic of the world. Like you
Mhm.
said, they have the doctors.
Wait, where else do you go beyond that?
There's really, you feel there's no other way.
Right.
Until you.
So we happened to meet for a second opinion on an implant appearance and the placement and so on.
Yes.
Then go from there. Then we kind of talked about maybe your jaw alignment might be the one that is the underlying cause of all these problems, even though it's labeled as fibromyalgia.
Yes.
What do we do for you?
Well, totally floored me because of jaw alignment, watching me walk, and just, I didn't even notice that my mouth was crooked. I had braces in 8th grade.
Mhm.
I had 4 teeth pulled. My
Got
teeth
4
were-
bicuspid removed, okay.
And my teeth were straight.
Mhm.
Didn't think my mouth was crooked.
It looked good.
And when you did the testing on me, I was floored just with the strength that I had from what I didn't have.
Better balance.
Yes, and balance. It was amazing.
Mhm. And then fast forward, then what do we do afterwards?
And then from then on, just just aligning my jaw and doing the physical therapy.
We did a trial basis. The fixed orthotic was supposed to be
Yes,
a reversible one. If it didn't help you, we could have taken it off.
right.
But what did you know?
It did help me. It helped me so much. Remember, I had headaches 24/7, the ringing in the ear, the grinding of the fan. My tremor was there. And when the orthotic went on, oh my gosh, my body just all of a sudden lit up, and it was like there would have been an hour or 2 hours that I had no headache. For the first time in 13 years, I had not a headache. And I'm going, this can't be happening. And then as we progressed through this treatment, I'd be a week, I wouldn't have a headache. And the grinding of the fan, the noise was clearing up. I'm like, I can hear better. I could always hear, but it was just that gnawing, just
Mhm.
grinding. And then within 2 months, my hand quit shaking. I mean, it just,
I
it'll
think
make me cry, because it's, I thought I had no other chance. And you've given my life back to take time into seeing what really had happened to me, where other doctors, they don't know.
Sorry.
But my family, myself, we love you, Dr. Robin. You've given my life back, totally.
It's a blessing to be able to help nice people like you. So, sorry to keep you
I'm
going. So then we did should we take a short break?
Sure.
Okay. Sorry.
I'm sorry.
Okay, then I will continue on. Sorry to make you have cried.
Well, I'm sorry, but I am so overjoyed and overwhelmed for
It's a good cry.
you've given me. So
Oh, thank you. So back to with the orthotic, fairly within a few weeks, what percentage improvement did you notice of your symptoms?
well, at that time I think I put 100% or better, 120, because it was just astounding the difference of how I felt.
Mhm.
It just was just unbelievable.
Okay. Then, of course, because it was improving you, then that is a temporary measure. Then the phase 2, we had a few options. And what did we do for you? You're the option that you guys chose
Then we went on with the braces,
for correction of the
the correction of the jaw.
jaw, where the teeth were in the wrong place, so to speak.
Right.
Okay.
Right.
Then finished with,
The porcelain.
okay. So you have full mouth reconstruction after we lined up your jaw, ideally.
Yes.
Okay. And tell me about that process. How did it go?
It was great. It was every month coming through and doing the adjusting just everything. It just made you feel so much better.
Okay.
Just
And
unbelievable.
how about any discomfort at all during going moving the teeth and so on?
No, just little, just not discomfort at all. Nothing that you can even remotely imagine. Because people, if you say you have a jaw alignment, they're thinking, oh, surgery and all that, and it's terrible. And this has been wonderful. Of course, I have loved coming here every month that I've had
For
to
the
come
follow-up, yeah.
for
Yeah.
follow-ups and everything, because it just what a huge difference in my life from the beginning to now. It is worth every cent, every.
You paid a lot of money.
Yes.
No question there.
Yes, we
Question
did.
there.
And we can't put money on your life.
All right. I'm sure there are those that are watching this thinking, surely, if a dentist, even though most of what I do is not purely tooth related, is able to help resolve it. Speaking of which, it's been about 3 years since we began. 11, no, a little less than that. September 11 is when I 2011 first met you.
Yes.
Right now it is January of 2014. I know initially you got better, symptoms improved almost 100% within a few weeks.
Oh yes.
Has it gone back?
No, never returned.
It's
I can wear my hair up in a ponytail.
You couldn't before?
I could never wear my hair in a ponytail. It hurt too much.
Mhm.
And the headaches were just horrific. Just couldn't.
What other thing you're able to do now that you haven't been able to before?
Oh, I mow the yard. I work more out. I mean, I'm working.
You guys own a
We own a
furniture store, yeah, in St. Joe.
We own a furniture store in St. Joe. I can play ball with my kids. I can paint. I can wear socks up to mid-calf. I could never do that before.
Oh, that would be painful too?
Oh, very painful.
Lots of things regular people just take for granted.
Very much so. It's just astounding when I put my hair up. I just wore it all day. Not an hour or two. I wore it all day long. And I loved it. It was like I was a little schoolgirl or something. I don't know. I just love the ponytail.
All right. So anything else to tell somebody that may be suffering with and been told you have fibromyalgia and nothing can be done? What would you tell such a person?
That is so wrong. Call Dr. Rahman.
Oh, don't lose hope. Just because this expert said, right?
Don't go by, yes, there's, life's too short and there is something out there for you. And if I didn't find Dr. Rahman, I would still be living in a lot of pain and just plugging through day by day. And not, with a smile, I never let people know how I felt. And deep down it hurts so bad. But don't let anybody tear you down that way, because it's not the truth. There is hope. And I'm serious. Just call Dr. Rahman.
Thank you so much.
You're welcome.